New tonight at 11, a closer look at COVID in Indiana and how it's putting hospitals in a pretty dangerous spot. Inpatient beds are filling up statewide at a level higher than at any time during the pandemic. Beds for COVID patients represent a big chunk of this. Hospitalizations have doubled in just a month. That is stressing a system already stressed for over a year.
Call me if you need anything.
Throughout the pandemic, we've seen hospitals at times under serious strain.
Our staff and our facilities are stressed and exhausted.
Capacity full in Tippecanoe County this summer.
Med-Surg has no beds.
Community health in Indy maxed out this fall. But right now, all across the state, doctors and nurses say we're nearing the breaking point.
And they say that, things are as bad or worse than they were during, the peak last winter. And the very real threat of our healthcare system, collapsing or struggling tremendously is probably even more of an immediate concern than, the arrival of the new variant.
The problem, new cases are surging. Indiana's positivity rate is at its highest since January. Hospitalizations have doubled in just a month. And perhaps the most worrisome part, hospital beds in use right now that are actually staffed with doctors and nurses.
And that's 70%, which is the highest it's ever been since the pandemic began.
70% of staffed inpatient beds full, according to the Department of Health and Human Services. And unlike the last spike last winter, many healthcare systems have fewer workers now because of burnout.
A lot are on diversion. A lot of nurses and doctors are working extra long shifts and working a lot more. And, we're really risking burning them out even further as we go into, this next wave here.
Vaccinations, boosters, even hosting smaller holiday gatherings are what experts say will prevent this crisis from getting worse.
When the pandemic started, we talked a lot about flattening the wave in order to save the healthcare system. And I think we're back in that situation again.
Recently, you might have noticed some changes at your pharmacy, different hours, longer lines. That's because, like most of the country, they are experiencing a worker shortage. Pharmacies are being forced to reduce hours or close for the day, like this Walgreens in Indianapolis. Dr. Veronica Vernon with Indiana Pharmacists Association said during the pandemic, the issue became worse, saying pharmacists are being asked to do a lot more with COVID vaccines and testing. And if you're dropping off a script or picking up a prescription, it's always a good idea to call ahead and make sure they're open. Also, if you can, use auto refill. It'll help speed the process along.